welcome to my website. My name is Dr. Jeff Dolgus, and I'm the owner and founder of Buffalo TMJ, which is a small dental practice here in Orchard Park, New York, although I don't really do any traditional drill and fill type of dentistry anymore. My professional mission is to help people overcome TMJ dysfunction without the need for surgery, orthodontics, or significant restorative dentistry. There are three primary characteristics that I think make my practice unique, and those are that we are arthrocentric, functionally driven, and holistically inclined. So what does all that mean? Arthrocentric means that I focus first on the jaw joint structures, the TMJs. I begin with the assumption that if a person has TMJ symptoms, then something might be wrong with the jaw joints themselves. I do a very detailed physical examination and usually some advanced imaging like a CT scan or an MRI to determine whether or not there's a structural problem. If there are structural instabilities or imbalances within the joints, then the muscles are going to have to compensate for those instabilities in order for the jaw to be able to do what it's designed to do, which is to chew food and breathe and swallow and speak. And that brings me to the second philosophical pillar of my practice, that is that we are functionally driven. I've created a program I call TMJ Rehab, which guides patients through exercises using the natural functions of the jaw to help restore balance to these structures. Chewing, breathing, swallowing, and speaking exercises are all integrated into my program in a very specific order. Finally, my practice is holistically inclined, which means me and my staff try to remember that these body parts, these physical structures we get focused on, are part of a whole person with a unique story and personal experiences that affect the way the body functions. And your story can significantly affect your body's ability to repair and heal. So I think it's important for us to recognize not only the physical and structural aspects of disease, but also the mental and emotional influences. And when it comes to TMJ dysfunction in particular, it's been known for a long time that emotional turbulence causes us to clench our teeth. Now, as a dentist, my area of expertise is the teeth, and I like to stay in my lane. And what's obviously within my scope of practice is to analyze and sometimes modify the way the teeth fit together, what dentists call the occlusion. I can do this by permanently grinding on the teeth, eliminating high spots and imbalances, which is a process known as equilibration. I can also do this by repositioning the teeth through orthodontic therapy. In some cases, the teeth themselves are badly broken down and need to be repaired. So a dentist can restore them with fillings, crowns, implants, or bridges to reestablish a stable occlusion. And in rare cases, such as traumatic injuries or severe degenerative joint disease, surgical modification of the jaw structures is necessary to restore skeletal support to the system. Now, all those treatment options are irreversible, meaning once you make those types of changes, there's really no going back. In my practice, my primary goal is to restore balance to the system without having to do anything irreversible. To accomplish this, I typically utilize some form of bite splint or occlusal orthotic, which I make myself from scratch here in my own lab. Recently, we've integrated digital technology, so we're now 3D printing these orthotics. And I actually believe that designing and constructing these devices myself over the last decade has been a very important part of the process for me, and it gives me some insight that other people might not have. I published a workbook in 2017 called TMJ Rehab and sold a few copies. Mostly this was a guide to give my patients to help them through the process of restoring good functional mechanics to the jaw. And then in 2022, I published a 12-week program, also called the TMJ Rehab Program, which is a video-based online curriculum designed to guide my patients through a more detailed and systematic process of functional jaw rehabilitation, utilizing concepts I've learned through dentistry, physical therapy, yoga, tai chi, meditation, myofunctional therapy, and many other fields. What I've tried to do here is to collect as much relevant information as I can, separate the wheat from the chaff, and then put it all together in an organized, easy-to-follow format. I often work with chiropractors, massage therapists, neurologists, ENT specialists, orthodontists, restorative dentists, and surgeons in trying to find the most appropriate solutions for each individual patient. I've been a practicing dentist now for 25 years, and for the last 12, I've been almost entirely dedicated to solving the problem of TMJ dysfunction. I've seen well over 4,000 new patients during that time, and that has allowed me to recognize a lot of patterns and details I may have missed if I was splitting my time with other dental procedures. So if you'd like to schedule an evaluation, you can call my office at the number above. If you can't make it out here to Buffalo, you can download my app, which is called TMJ Rehab, and the first week is free. You can also take a look at my YouTube channel, which is also called Buffalo TMJ. I hope you could find something helpful in all of these materials, and again, I thank you for visiting my website.